About 10 million people in the UK have doctor-diagnosed arthritis, and that number is set to rise to around a quarter of the adult population by 2024, mainly because the population is ageing. But it's often not seen as seriously debilitating, so people living with the condition are largely left on their own to get relief. Well, that's where Dr Arthritis comes in. To find out more, let's meet the co-founders of the company, two medics, Saurabh Srivastava and Adam Gunasekara. I'm Sarah Lockett. Welcome to Great British Business. Doctors Adam and Saurabh, welcome to the London Stock Exchange studios.
Hi.
Hello.
So just for people who don't know very much about arthritis, it's actually a catch-all term, isn't it, for some 200 different conditions? Can you tell me about that?
Yes, there are actually many different types of arthritis. However, the majority of arthritis is either osteoarthritis or rheumatoid arthritis. Osteoarthritis is a disease associated with the elderly. It's usually due to wear and tear. Rheumatoid arthritis, on the other hand, is an autoimmune condition. It affects more women than men, and it normally starts at a younger age.
And how does it affect people's quality of life, their mobility, pain?
So the main symptoms of arthritis are pain, stiffness and swelling. And of course, this can affect people to varying degrees. Some people are barely affected at all, and it only affects them when they're doing extreme exercise. Other people, it can really interfere with their quality of life. For example, for some people, going up the stairs or even doing their buttons on a shirt can be extremely difficult.
And Saurabh, you make compression products and supports. Can you tell me a little bit more about your brand?
Yeah, sure. So Dr Arthritis is an international e-commerce company founded by Adam and myself during our time working as junior doctors. We actually know each other from our medical school days at Imperial. So Dr Arthritis aims to improve the quality of life for those suffering with arthritis and other joint conditions. And we try to do this by providing them a high-quality physical joint support product accompanied by a short, informative medical handbook. And these two are tailored to the specific joint that the customer buys the product for. We have a portfolio of over 40 products now, and our best sellers are our arthritic gloves, our wrist braces, and our knee supports. And to date, over 750,000 customers have actually benefited from our products. We sell the majority of our sales through Amazon and our website.
And Adam, how effective are your products? Because you're not curing arthritis, are you?
No, they don't actually cure arthritis, but they can really help with the symptoms. They do this through supporting the joint, aiding the soft tissue, mainly muscles and tendons around the joint. They can also provide compression, which increases blood flow to the affected area and also can improve swelling. And for some people, it's just the warmth that the products give can really improve their symptoms.
And you brought some products in with you, haven't you?
Yes.
Tell me what we have.
I actually have a product for the wrist. It's not actually used for arthritis, but rather carpal tunnel. It goes over the wrist like so. And what it does, it keeps your wrist fixed in a neutral position. And for carpal tunnel syndrome, it's a condition where fixing your wrist really helps with the symptoms of numbness and tingling.
Now tell me about the handbook, Saurabh, because you've written this yourself. It's 40 or 50 pages long. You're both medics, so what does it add?
So the handbook itself is a very small handbook, sort of pocket size, so customers can take it around with them. And it contains lots of medically accurate information that we think that the customer will really benefit from. So it starts by talking about arthritis in general and a bit about our brand and our brand promise. It then talks about the specific conditions for the joint. So in this case, it's about the wrists. So I'll be talking about certain wrist conditions such as carpal tunnel, as mentioned, and repetitive strain injury. It then goes on to the rehabilitation and strengthening exercises portion, where there are lots of exercises and actual demonstrations for customers to follow to help prevent injury and strengthen the joint. And lastly, it ends with just some general lifestyle advice to improve the quality of life.
And Adam, how important is that lifestyle advice, diet and exercise, to stop the condition getting worse?
Well, with any condition, providing education is really important as it allows people to self-manage. With regards to arthritis and diet and exercise, diet advice allows people to maintain a healthy weight, and maintaining a healthy weight decreases the pressure on your joints and can really improve symptoms. Exercise, on the other hand, provided it's in the right amount and right type, can also really improve symptoms as they increase the muscle and ligament strength surrounding the joints.
And you mentioned that you're an online-only business selling through Amazon and your own website. So what advantages and disadvantages does that have?
Sure. So e-commerce is actually growing at a substantial rate, and many people actually prefer shopping from the comforts of their own home online rather than walking into physical stores. The main reason for this is obviously ease, as they can purchase anything they want from a simple click of their mouse. And this is a huge advantage for us as an online business. 1 in 4 customers in the UK actually have an Amazon Prime account, and this number is only growing. As far as the disadvantages, a lot of the population we cater to are elderly, and a lot of these people are less computer literate. This, however, hasn't proven to be a big problem, as most of them usually have children or grandchildren who buy the products on their behalf.
And you're both medical doctors, aren't you? So, I mean, you're never going to be out of work, but why have you decided to get into this venture?
So it's actually while working as medical doctors in the NHS, we noticed that a lot of patients were suffering from joint pain, and a lot of them weren't doing anything about it and had no sort of understanding of the reasons behind their joint pain. So when we founded Dr Arthritis, we had 2 intentions: to educate people with regards to joint pain and provide a non-invasive solution for their joint pain in the form of our products.
And you'd say the same, I guess, Sora.
Yes, I do.
Okay, well, good to hear from both of you today. Thanks for telling us all about it.
Thank you
Thanks
very
for
much.
having us.
Well, that's all we've got time for now. But from me, Sarah Lockett at the London Stock Exchange Studios, it's goodbye and thanks for watching.